My name is Michael Zen, and one of the questions I'm often asked by patients is, what is fat transfer? Fat transfer actually is part of many of the plastic surgery procedures that we perform. It involves removing fat from one area of the body, generally with liposuction, processing that fat tissue to get clean cells, and then injecting that fat in areas where we want augmentation or fill. Generally, the smaller amounts that we put in small packets, the better the fat will survive. The fat we take out actually has stem cells in it, and certain fractions are better to use than others. And some areas are just easier to graft and easier to take fat from. Surprisingly, though, there really is no standard way to perform fat transfer, and each plastic surgeon may do it a little differently. So I think technique is very important, and for those of us who've been doing this for a long time, we've seen long-lasting results. The problem is, if you just put fat in and don't use proper technique, the initial swelling can look great, but you'll be disappointed many months down the road when the result disappears. Certain areas we need to be careful of. Fat grafting around the breast is commonly performed. However, fat grafting to augment a breast and place fat grafts around breast tissue is highly controversial, and I don't recommend it. Also, many procedures involve a large amount of fat being placed at one time. Those areas are going to have less take of fat, and what that means is less of the fat will survive only because you need a certain amount of blood supply to keep fat alive, and the more you put in, the less blood supply there is to share. That's not necessarily a bad problem, but just realize that some of the result will disappear over time. The reason that fat grafting is a part of almost every cosmetic procedure we perform is because it allows us artistic expression. And what that means is that we can perfect results, we can soften areas, we can get the shapes and contours that we like with just a little bit of fat tissue where sometimes just the surgery alone or an implant can't. And again, if all the fat that we place doesn't survive, that's okay. In fact, we plan for the fact that not 100% will survive, and the beauty is that you can always have it done again. Generally, these procedures are not painful. They often have a little bit of bruising where the fat's removed and where the fat is placed, but fortunately, there's not a lot of downtime either. So see your board-certified plastic surgeon. Make sure they have experience with fat grafting. Those of us who perform this regularly get long-lasting, durable results that you'll be happy with.